If you're preparing for knee replacement surgery or helping someone who is, you might have heard that bruising can appear after the procedure. Sometimes the leg even changes colors from red to purple, green, or yellow. That can look alarming, and it's completely understandable to feel worried. In this video, we'll gently guide you through why bruising occurs, what's normal, what helps the healing process, and when it's time to check in with your doctor. The goal is simple: to help you feel informed, calm, and prepared. Let's start by understanding what a bruise actually is. Inside your leg are thousands of tiny blood vessels. Think of them like very fine garden hoses carrying blood to your tissues. During surgery, even when performed gently and carefully, some of these delicate vessels can get pressed or stretched. When that happens, a little blood seeps out under the skin. It doesn't mean anything is torn or damaged beyond repair. It's simply your body responding to the work that was done. A bruise is not a sign that something went wrong. In most cases, it's a normal part of healing. During surgical procedures, the surgeon uses a device called a tourniquet. This device is placed around the upper thigh and is gently tightened to temporarily reduce blood flow, helping to maintain a clean and clear surgical field. Once the surgery is complete, the tourniquet is released and blood flows back into the area. Sometimes this sudden return of circulation causes those tiny vessels to leak a little more, which can lead to wider or darker bruising than people expect. It may look dramatic, but this is a common result of controlled surgical technique, not a complication. Let's look at a few other reasons bruising can appear after knee replacement surgery. The surgery itself. Soft tissues are moved gently to access the joint, which can leave temporary marks and bruising. Blood thinners. Many patients receive medication to prevent clots. These are important for safety, but they also make bruising more likely. Natural body tendency. Some people simply bruise more easily than others. Age, skin type, and circulation can all play a role. If you notice bruising spreading toward the ankle or shin over several days, that is also normal. Gravity naturally pulls fluid downward. Ice. Applying ice as instructed can reduce swelling, slow the spread of bruising, and ease discomfort. Cooling the area slows down fluid movement and helps minimize further bruising. How to do it safely. Use an ice pack wrapped in a cloth. Never place ice directly on the skin. Many doctors recommend typical timing of 15 to 20 minutes at a time, several times daily. Why it helps? Ice gently signals blood vessels to narrow temporarily, reducing leakage under the skin. Compression socks. These assist in enhancing circulation and preventing fluid accumulation in the lower leg. Your doctor may provide compression socks. These aren't just socks. They are carefully designed to apply even pressure to the leg, helping push excess fluid upward so it doesn't settle around the knee or ankle. What it does helps reduce swelling, lowers the risk of blood clots, and can limit how much bruising spreads downward. Wearing tips. Ensure they are smooth against the skin, not rolled down and not too tight. Follow the timing instructions given by your care team. Elevation. When possible, resting with your legs slightly raised allows fluid to drain away from the knee naturally. Raising the legs slightly above the level of your heart allows gravity to assist with healing. This helps extra fluid to drain from the knee, reducing swelling and pressure on healing tissues. Simple method. Place pillows under your ankle, not directly under the knee, to support gentle elevation. When to do this is especially helpful during rest periods in the afternoon or evening when swelling often increases. Nutrition. Healing uses nutrients from the food you eat. Choosing meals with good protein, vitamins, and hydration gives your body the tools it needs to repair bruised and swollen tissues. Helpful foods. Protein. Eggs, fish, beans, lean meat supports tissue repair. Vitamin C, berries, oranges, bell peppers supports blood vessel healing. Hydration, drinking sufficient water and juices helps the body circulate fluids and reduces swelling. Gentle reminder, even small healthy snacks throughout the day can have a positive impact. These small steps, done consistently, can make a meaningful difference in your comfort and healing speed. For caregivers, your support makes a big difference. Gentle reminders about icing, hydration, and elevation, delivered kindly and without pressure, can help the patient feel cared for rather than managed. Encouragement continues to be a powerful form of medicine. Days 1 to 3. Bruising may appear dark red, blue, or purple. This is expected. Days 4 to 7. Colors may shift to green or yellow as the body breaks down the bruised blood under the skin. This is a sign of healing. Weeks 2 to 3. Bruising usually fades. Some discoloration may linger but should slowly improve. Everyone heals at their own pace. It's okay if your timeline looks slightly different. While bruising is normal, there are a few signs to watch for. Contact your healthcare team if the skin becomes very hot, red, and painful in a specific area. You notice spreading redness or streaking. The swelling continues to worsen instead of slowly improving. If you feel short of breath or experience chest discomfort, these symptoms need urgent attention. Bruising after knee replacement surgery can look concerning, but in most cases, it's simply a part of the body's natural healing response. With rest, proper care, and a little patience, the bruising fades and your focus can return to regaining strength and movement. If this explanation was helpful, feel free to share it with a loved one or caregiver. And always remember, you're not alone in this process. Healing takes time, but every day brings small progress. Stay connected with us for more helpful health guidance by subscribing to the channel. You can also visit our website at vcareassociation.org for additional resources. Thank you for taking the time to spend with us.